January 25th, 2020. It begins. Global breaks the news.
We're learning the man had signs of the disease while on the plane back to Toronto.
The first case of a virus not even named yet is found in Canada. A man in his 50s who had just returned from Wuhan is isolated at Sunnybrook Hospital. The next day,
this could be a massive outbreak in Ontario right now.
Well, I want to rely on the information that we've received from the Ontario Medical Officer of Health.
Over the next 6 weeks, as cases rise, life remains largely unchanged. The Premier urging Ontarians to go on spring break.
Go away, have a good time, enjoy yourself.
COVID-19 biostatistician Ryan Ingmund.
That's what led to a lot of the cases that we saw at the end of March and also April 2.
March 23rd, non-essential businesses are ordered closed for 14 days. 4 days later, an emergency alert warning those who went away on spring break to self-isolate. April, as Easter arrives, so too a new record. Over 5,000 active cases in Ontario. The Premier enjoys high approval ratings, but in long-term care homes across the province, deaths begin to mount.
Our worst nightmare and possibly beyond that came true.
The province calls in the military to help with 7 of the hardest hit homes.
Will the Premier now agree that his Minister of Long-Term Care failed to protect seniors in our homes?
A month later, in-class learning is cancelled for the remainder of the school year. Mid-May, revelations in a scathing military report shocked the public. Disturbing stories of cockroach-infested rooms, seniors not being cleaned, and some crying out for help for hours.
It was the worst report, most heart-wrenching report I have ever read in my entire life.
By July, transmission is reduced. Toronto and Peel are reopening. Lockdowns lifted. Gyms, indoor dining, and theaters welcome back customers.
I'm just yearning to get back here, put up a little pump, and get a little sweat on.
August, Premier Ford continues a campaign-style tour of the province, and life seems to be getting back to normal. But as kids head back to school in the fall, cases begin to surge. Deaths and hospitalizations increase.
Ontario is now in the second wave of COVID-19.
That's where things really started to fall apart, was the end of September.
As long lines at testing sites continue and the government scrambles to increase testing capacity, September turns to October. 55,000 cases and transmission increases, but the Premier resists implementing tougher restrictions, rejecting calls to close indoor dining and retail.
COVID-19 is spreading in a serious way.
We're flattening the curve.
We definitely were not flattening the curve. We knew since August 10th and on, we saw a reproductive value above 1.
Hi, Grandma.
Pull through, you can do it.
It was hard seeing my mom in a coma, basically. She was in a medically induced coma. She was on the ventilator for 17 days.
It's scary for me, to go outside, to go anywhere, especially with the second wave.
November, a new tiered, color-coded system of restrictions is unveiled.
I think this is a good plan.
If we had someone move from one color to the next, there were hardly any restriction changes.
As much as we're seeing the numbers go up, we still have the lowest numbers for any large jurisdiction.
Late that month, the messaging drastically shifts.
The situation is extremely serious, and further action is required to avoid the worst-case scenario.
By the start of December, with cases skyrocketing, the health table indicated the lockdown was working.
Some individuals who do some of the data analysis have said they are seeing indications that the lockdown has had an effect.
The lockdown did not have an effect.
It's the worst possible thing because no one deserves to die alone or feel like they're alone.
Reality sets in. By Christmas, lockdowns would not be lifted. Ontario was entering dark days, but a beacon of hope arrived. On December 14th, Anita Quitigen, a personal support worker, becomes the first person in Ontario to receive the Pfizer vaccine.
Because of the guidelines Dr. Williams has put in place and his team, we're seeing a plateau per se.
We were seeing those cases still increase at that time. What should have been done around that time is we should have announced then that schools were going to be moving to online.
That did not happen, nor did a strict lockdown. Holiday shopping continued in the GTA. On Boxing Day, a province-wide lockdown is implemented.
It was way too late. Even by acting 5 days later, the issue is we've already allowed Christmas gatherings.
Ford did indicate drastic action was coming.
And when you see the modeling, you'll fall off your chair.
Whenever information was available and he had information, we would know right away. It's not a game show. We don't want to wait till Tuesday.
But when action came, a stay-at-home order, the result was confusion, mixed messaging about the rules and what people could and could not do. By mid-January, the death toll passes 5,000. Modeling data shows we could hit 40,000 cases a day.
This lockdown which we are in right now is nothing like the one that we had back in April. It's always important that you set the bar high, and you can always lower the bar.
Don't take this for a joke, because personally, when the pandemic first started, I thought that, hey, I'm a young man. If I get it, I'm just going to get a cold. When I fell unconscious that day on May 5th, for all we know, I could have died that day.
2020, a year Ontario and the world changed in an instant. COVID-19 is far from behind us, but hope is on the horizon. To the tired, the isolated, the fearful, soon there may be reason to exhale. Travis Dhanraj, Global News.